I would like to thank Arnett for the support that they have given me throughout my nursing career. They helped to support me during my master's degree and have also funded various continuing education opportunities that I've participated in. So happy to be here today. I have worked in cardiac surgery for over 20 years. I am the nurse practitioner that is working in the new cardiac surgery follow-up clinic. Generously funded by a grant from the University Hospital Foundation, the clinic was started to give post-operative support to patients after they have heart surgery. There's an average of 7 people per day that have heart surgery at the MAS. Those people are expected to follow up with their family physicians within a week of discharge from hospital. Along with the challenges of finding a family physician and the likelihood of getting in to see them quickly, that 1-week follow-up was not happening. An NP clinic can pick up on complications more quickly. Patients can get medications adjusted, be started on antibiotics for early signs of infection, and can be admitted to virtual hospital services rather than a real hospital bed. Sometimes they are admitted back to hospital, but ideally, problems are picked up sooner, resulting in a shorter hospital stay. The clinic provides specialized support to answer patient questions and ensures that referrals to other specialists occur. The patients are seen in person by myself at the MAS, they're called by telephone by myself, or are seen virtually using Zoom and are followed for 1 to 2 visits, depending on their needs. I was hired to start the clinic as well as evaluate the project to help justify permanent funding. I never imagined what a big job it would be to start a clinic and then assess its value. And let's face it, in these tight economic times, evaluation of a project is key. Money is tight and it's hard to get funding for a new clinic without being able to prove its value. Fortunately, shortly after being hired, I had coffee with my good friend Carmel, who offered to lend me a hand and some of her expertise with the data collection evaluation. And with that, I'll pass it over to Carmel.
Our evaluation plan was focused on what patients and staff were experiencing in the clinic, and as well as the numbers, of course. And our team of graduate students recruited patients while they were still in the hospital, and they interviewed them by Zoom to determine what their experience was with having seen Stephanie once they were at home. We also surveyed the staff and physicians about their experience referring patients to the clinic and the value of that clinic. We also interviewed Stephanie as the NP and the leadership team about their experience starting the clinic, and including what they might do differently next time. She started in January and saw 14 patients that month, and by June, she saw 114 patients that month. Which, if you knew Stephanie well, that wouldn't surprise you. In total, she saw 910 individuals in 2022, half in person, half by phone. Of those 910 individuals, she followed up with 258 of them, 430 times. So she's been super busy. I just want to express my appreciation to Arnett, specifically for the opportunity to present our work today. And also, without the funding provided by Arnett to conduct this evaluation of the NP clinic, we wouldn't be able to share these details with you today, and you might not even know that this clinic existed.